Now we'll talk about the drug treatment in Parkinsonism. First of all, what is Parkinsonism or Parkinson's disease? It is a neurodegenerative disorder in which there is destruction or your degeneration of inhibitory nigrostriatal pathway. Right? Now, this nigrostriatal pathway is responsible for releasing your inhibitory neurotransmitter dopamine. In Parkinson's disease, there is imbalance between your excitatory and inhibitory neurotransmitters. In your basal ganglia, let's see, there is excitatory signal and there is inhibitory signal. Your excitatory signal is mainly by your acetylcholine and inhibitory is by dopamine. When there is destruction of the nigrostriatal pathway, the dopamine levels decrease and there is relative increase in your ACH, which leads to the features of Parkinsonism. So how does the patient present? The clinical presentation. The patient presents with resting tremors, then muscle rigidity, then you have your mask-like face, expressionless. Also, there is this characteristic gait of a Parkinson's patient. You call it shuffling gait. The posture of the patient is stooped. You get stooped posture. Now let's talk about how we can treat a patient with Parkinson's disease. So there is no specific treatment, but we can give some drugs which provide symptomatic relief to the patient. Also, there is this theory which explains how this degeneration of the nigrostriatal pathway takes place. See, we don't really know how this degeneration happens, but there is this proposed there is this hypothesis which goes like this. So you have your dopamine which gets oxidized, so you have oxidation of dopamine, and the enzyme responsible for this is monoamine oxidase B, MAO-B, and also your aldehyde dehydrogenase. In doing so, there is production of oxygen free radicals in the presence of iron. The basal ganglia is rich in iron, so your basal ganglia has iron. So while this process of oxidation of dopamine via these enzymes MAO-B and aldehyde dehydrogenase, there is production of oxygen free radicals like this. Now these oxygen free radicals are responsible for destruction of the nigrostriatal pathway. So this is just a proposed theory. Also, there is this hypothesis that certain toxins are present in the environment which can lead to dysregulation of mitochondrial electron transport chain, which can similarly lead to production of free radicals, reactive oxygen species, and can cause damage to the neurons in the nigrostriatal pathway. Well, anyways, in Parkinson's disease, we know there is relative increase in ACH, so the equilibrium between dopamine and ACH is disturbed. Dopamine levels are decreased, and there is relative increase in acetylcholine. So, as treatment, what we can do is we can give some drugs which can like act as dopamine or can increase the levels of dopamine, or we can give drugs which can decrease the acetylcholine levels. So first we have these drugs which are called your dopamine precursor. Your dopamine precursor. Let's write it here. First you have dopamine precursors. What does precursor mean? That this drug gets converted to dopamine in the brain and also in the peripheral tissues. The drug is called levodopa, L-dopa. This levodopa, it gets converted to dopamine in CNS and peripheral tissues. Now, if it gets converted to dopamine in peripheral tissues, in the periphery, it causes side effects which are associated with levodopa, and when it gets converted to dopamine in the CNS, it produces the desired effect and reduces the symptoms associated with Parkinson's disease, which we have already talked about. Now, what's the problem with this drug? That a lot of it gets converted to dopamine in the periphery via the enzyme dopamine decarboxylase. So what we can do is we can inhibit this enzyme. So there are these other drugs which are called decarboxylase inhibitors. Your decarboxylase inhibitors. These inhibit the dopamine decarboxylase enzyme. So the levodopa which got converted into dopamine very fast in the periphery, now this unnecessary conversion is slowed down and more your levodopa is available for the brain to convert to dopamine, right? So the examples of these drugs is carbidopa and your benserazide. And you are well aware that carbidopa is used in combination with your levodopa, and when used in combination, the amount of levodopa that you have to administer gets reduced to 1/4. Alright, and the side effects which were due to peripheral conversion of levodopa to dopamine are also significantly reduced. So this is a really effective and standard combination used, levodopa plus carbidopa, for the treatment of Parkinsonism. The other drugs used in Parkinsonism include dopaminergic agonists. So your dopaminergic agonists. So these drugs act on dopamine receptors, and just like dopamine, stimulate or inhibit the receptor depending upon the receptor type. So these includes your bromocriptine, ropinirole, and your pramipexole. Your pramipexole. Okay, so these are dopaminergic agonists. Now we talked about this monoamine oxidase B enzyme in the CNS, which causes breakdown of like metabolism of dopamine. If we inhibit this enzyme, more dopamine will be available. So next category of drugs that we have are called monoamine oxidase inhibitors, your MAO-B inhibitors. These include your selagiline and your rasagiline. Okay. There is this other enzyme which is called COMT, catechol O methyl transferase, which is also responsible for your breakdown of dopamine. So similarly, we inhibited your MAO-B, we can inhibit this COMT enzyme. So we can use COMT inhibitors in Parkinsonism. Examples include your entacapone and tolcapone. Right? Then we have this other category of drug which is called NMDA. NMDA is a receptor of glutamate, your NMDA antagonist. Glutamate is an excitatory neurotransmitter which leads to increased muscle tone. If we inhibit this effect of glutamate, it can relieve the symptoms of Parkinsonism, and so NMDA antagonists are used in Parkinsonism, but their effect wears off very rapidly, and also the tolerance develops to these drugs, and they are not really commonly used. Example includes amantadine or amantadine. Next, you can use drugs which affect your cholinergic system. So you can use central anticholinergics. You have your anticholinergics which act in the CNS. The examples of central anticholinergics are benzhexol, piperidine, and procyclidine. Then you can also use antihistaminics, because some H1 antihistaminics, your first generation antihistaminics, have additional anticholinergic properties. So you are using antihistaminics because of their anticholinergic properties. So the examples include, you had your procyclidine here, and in the antihistaminics, promethazine, and other drug called orphanedrine. Right? So these are the drugs used in the treatment of Parkinsonism. You have your dopaminergic agonists, bromocriptine, ropinirole, pramipexole, your MAO-B inhibitors, selagiline, rasagiline, COMT inhibitors, entacapone, tolcapone, then NMDA antagonist, amantadine, your central cholinergics, benzhexol, piperidine, procyclidine, antihistaminics which have anticholinergic property as well, promethazine, orphanedrine, and your most important drugs, your decarboxylase inhibitors, carbidopa benzerazide, and your dopamine precursor, levodopa. And levodopa, carbidopa are used in a combination. Now, a really important point which I want to discuss here is that pyridoxine, your vitamin B6, is a cofactor of this decarboxylase enzyme. right? So you know that old patients suffer from Parkinson's, and most of the doctors prescribe multivitamins to these geriatric population people. So this can actually lead to more conversion of your levodopa to dopamine in the periphery, and can cause your therapeutic failure of the drug, right? So refrain from using this pyridoxine in patients of Parkinsonism. Now, if you are using levodopa and carbidopa in combination, like I said, then this carbidopa is inhibiting this enzyme. Since the enzyme is inhibited, then this B6 won't have as much effect as it does when decarboxylase inhibitors are not used. So if you are using levodopa carbidopa combination, this effect of B6 which I talked about is very minimal. So you can give multivitamin if you are using levodopa carbidopa combination. So that's all.